SecuSurvey is an innovative information analytics platform grounded in the principles of automated intelligence. It is designed to maximize workflow efficiency, meaningfully engage the patient population, and enable real-time predictive analysis. Our platform is composed of three core systems: the Patient Engagement Quality Metric, the Provider Engagement Quality Metric, and the Protocol Compliance and Analytics Frame. The patient and provider metrics can easily be customized to your hospitals and clinics, focusing on the area most critical to your operations. The Protocol Compliance and Analytics Frame allows the user to assess various aspects of the provider-patient interaction through both direct patient input and background data processing. In order to fully demonstrate what SecuSurvey can do, we will now walk you through a brief clinical encounter. We will highlight several common problems our patient and her providers face and discuss the different solutions our platform offers. Let us introduce Deborah Smith, a 47-year-old female smoker with a history of type 2 diabetes, hypertension, and hyperlipidemia. She presents as a new patient with knee pain to the doctor's office and checks in with the front desk staff. She completes all the necessary paperwork and is placed in a room several minutes later. The attending orthopedist, Dr. Halsey, then joins Ms. Smith and starts the clinical encounter. After asking a few pertinent questions and finishing a focused physical exam, Dr. Halsey begins recording his assessment and treatment plan in the clinic's electronic health record system, EHR. He explains that she has likely injured the medial collateral ligament and will need to perform daily exercises, use ice packs, and take 1 aspirin every morning. Problems start to develop even at this early stage in our encounter. Ms. Smith does not understand her diagnosis and can only remember 2 of Dr. Halsey's recommendations, and unfortunately, she is not alone. Studies have shown that nearly 60% of patients cannot recall their own diagnoses, and that 40% either misinterpret or completely forget their provider's healthcare advice. Even worse, only 1/4 of patients can accurately list all of their active medications. Such problems often come from a lack of provider engagement with the patient. To fix this, Dr. Halsey could verbally reinforce the care plan, print out a copy of his instructions, or even make them available on the EHR patient portal. These options, however, are static and do not actively encourage Ms. Smith's continued participation. There is a significant drop in communication once she leaves the clinic. In fact, only 45% of the providers communicate with their patients between visits. This often leads to medical noncompliance. Nearly 83% of Americans don't follow treatment plans exactly as prescribed, which in turn can lead to patient injury and more. SecuSurvey's answer to the problem of patient engagement is its 2-way communication bridge, Outbound. By independently analyzing the EHR, SecuSurvey is first able to determine what exactly each patient needs to stay on top of their health goals. Our platform then keeps them engaged by sending interactive checklists, reminders, educational resources, and much more to their very own private portal. And with MedAssist, we create an easy-to-follow active medication schedule that can be viewed on the patient portal or quickly accessed from any smartphone. Ms. Smith definitely won't forget to take her aspirin now. You may be thinking, okay, these are definitely great solutions, but how can you guarantee patients will use all this? The answer is actually quite simple. SecuSurvey uses a customizable point-based system that rewards patients for every task they complete. Should a patient fail to complete a task within a predetermined time frame, they will be alerted via automatic text message or email. If the patient repeatedly has unfinished tasks, SecuSurvey will notify their designated institutional mid-level provider to personally contact the patient. Studies have shown that patients engaged in their care have 12.5% fewer hospital admissions and 5.3% reduced medical costs compared to their peers. Let's return to the exam room, where Dr. Halsey is concluding the clinical encounter with Ms. Deborah Smith. After answering a few questions, Dr. Halsey schedules a follow-up appointment to see her again in 1 week and proceeds to leave the room. Ms. Smith, however, is upset about some of the care she received and is unsure how to voice her concerns. The second problem we address is patient feedback for providers. Traditional feedback options include on-site paper surveys and direct mail or internet questionnaires. Unfortunately, these do not provide timely access to the data being collected and frequently lack context for the people being surveyed. Perhaps the biggest downfall with conventional surveys is the low response rate that endangers a study's validity, as less than 2% of the entire patient population is ever successfully surveyed. On the other hand, reliable surveys can be a very effective tool. Nearly 80% of the practices identified as better performing use patient satisfaction surveys. Using these surveys to improve clinical performance and ensure patient satisfaction can save up to $225,000 per malpractice case and produce between $2.2 and $5.4 million of additional revenue for even small to medium-sized hospitals. So, what's our solution? We at SecuSurvey understand the importance of quick survey collection and analysis. It's in our name, after all. Our quality analytics platform can screen patients based on various criteria, such as age, sex, and comorbidities, and automatically create questionnaires for them to evaluate the clinic, provider, etc. These surveys will then be forwarded to the patient portal, where patients will receive regular reminders until completion. Providers with administrative privileges can view the survey data in real time, with helpful charts and graphs summarizing what has been collected.